Can you introduce yourself?
Yeah, I'm Dr. Paul Song. I'm board member of Physicians for National Health Program.
And then what are you doing here today?
Well, I'm here to express my outrage at the fact that SB562 has been suspended, and when too many people are still uninsured in the state of California, where too many people are still struggling to pay their monthly premiums, and where a lot of people delay seeking care because they can't afford the co-pays and deductibles.
And so you're an oncologist. Can you tell us about from the doctor's perspective? Is this a bill that will help doctors or hurt doctors?
I think one of the biggest misconceptions is that a single payer bill will reduce earnings for physicians, and that's simply not true. When you look at how much money we spend hiring people to fight with insurance companies and get pre-authorization, the average doctor's office spends over $80,000 to do that per doctor. So if you simplified the system and you had one billing system where you knew what was covered and what was not, you would eliminate that cost, and you might get less reimbursement, but you'd end up coming out ahead of the game because you'd have far less headache and far less administrative overhead.
And then what about, I guess you're not a general practitioner, but do you have a feel for how patients get denied care in our current medical industry and how that affects them?
Well, over the last 9 years, it's estimated there's been over 45 million denials here in the state of California. And the reality is that if you fight hard enough, meaning if you're a patient and you're willing to spend hours on the phone with case managers, or if your physician is willing to fight with that, 50% of those denials get overturned. So what that tells me is that the insurance industry many times will deny things thinking that it's too difficult for you to try to appeal it. And the idea is that they'll just keep that money. And if they do lose, then they'll end up giving that money back after it's sat in a bank for several months collecting interest. The idea of, again, eliminating the middleman is to put a system in place that is aligned with patients. Right now, it's not in the insurance industry's interest for people to get sick. That's why they call it a medical loss ratio. The idea that whenever they pay out something for patient care, it's considered a loss. That immediately tells you something right there. And then you have a system that basically only makes money by denying care. Eliminating that and putting it in place of a single payer system that only cares about doing the right thing would greatly diminish the amount of denials and make things better for everyone.
And so you're saying that insurance industry has a fiduciary responsibility to make a profit, and it's not profitable to give care to people. Do you also think that they influence our politicians?
Oh, absolutely. As you look at the amount of money that the insurance industry and the pharmaceutical industry spend here in Sacramento, and the amount that legislators receive and how they vote, there's definitely proof that it influences their decisions.
And so you were a surrogate for Bernie Sanders, if that's correct, and he ran a clean campaign. Is that what we're looking for our politicians here in Sacramento?
Well, ultimately, we want a system where politicians will listen to us, the constituents, rather than special interests.
And one more question. I get this question a lot from people when we're advocating for single payer is, how do we compare to the Canadian system? Because they're always telling me they have to wait long waits, and would that happen here in the United States if we had a single payer system?
Well, I will say this. First of all, in the United States, if you do not have insurance or if you have Medi-Cal, you will wait to see a doctor. You will wait much longer than people who have Medicare here in the state, in the United States. And Medicare is our single payer system. One of the things you always hear about Canada is people waiting in line, and there's this massive emigration of people coming to the United States, but that's simply not true. And as a matter of fact, more doctors who train in the United States go to practice in Canada than people who train in Canada coming to the United States. Why? Because this system actually is better for them. The other thing I will just say is if you look at hip replacements, seniors who are on straight Medicare have shorter waiting times than seniors who are on private HMOs in terms of hip replacements. So those those facts simply are not true.
Excellent. Dr. Song, I appreciate your doing this interview and also your advocacy for single payer health care in California.
It's my pleasure to be here. Thank you.
Thank you.